Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic Sustainable Development Goals and Nutritional Programs under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: A healthy outside starts from the inside. Content outline: Overview of Sustainable Development Goals, Introduction to Nutritional Programs, National Level Nutritional Programs, and Recent Advances in Multiple Choice Questions. At the end of this presentation, the participants will be able to appreciate the Sustainable Development Goals and targets relevant to public health priorities, identify and describe the different national level nutritional programs, including their aims, demographics, and geographic focus, explain the integration and management processes of these programs, emphasizing the importance of cross-sectoral collaboration, and discuss the global recent advances and answer multiple choice questions. Sustainable Development Goals. The 2030 Agenda for Sustainable Development, adopted by all United Nations member states in 2015, provides a shared blueprint for peace and prosperity for people and the planet, now and into the future. At its heart are the 17 Sustainable Development Goals, which are an urgent call for action by all countries, developed and developing in a global partnership. The UN SDGs recognize that ending poverty and other deprivations must go hand in hand with strategies that improve health and education, reduce inequality, and spur economic growth. These are the 17 Sustainable Development Goals. We will get them one by one. Though the goals are broad and interdependent, 2 years later, in 2017, the SDGs were made more actionable by a UN resolution adopted by the General Assembly. The resolution identifies specific targets for each goal, along with indicators that are being used to measure progress towards each target. The year by which the target is meant to be achieved is usually between 2020 and 2030. To facilitate monitoring, a variety of tools exist to track and visualize progress towards the goals. All intention is to make data more available and easily understood. As per the UN SDGs, all members unite together for their common future. Targets and indicators. The lists of targets and indicators for each of the 17 SDGs were published in a UN resolution. Each goal typically has 8 to 12 targets, and each target has between 1 to 4 indicators used to measure progress towards reaching the targets. The targets are either outcome targets, circumstances to be attained, or means of implementation targets. Uh, the Sustainable Development Goal 1 is end poverty in all its forms everywhere. These are the targets and indicators. The global progress of SDG 1, the slowdown in progress on poverty reduction since 2015 has been further set back by the COVID-19 pandemic, with the global rate of extreme poverty rising in 2020 for the first time in over 20 years. SDG 2 is end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. These are the targets and indicators. As for the global progress of SDG 2, even before the COVID-19 pandemic, the number of people experiencing hunger globally and suffering from food insecurity had been rising gradually since 2014. The pandemic has increased the vulnerabilities and inadequacies of global food systems, potentially leaving hundreds of millions of more people chronically undernourished and making the goal of ending hunger more difficult to achieve. Sustainable Development Goal 3 is ensure healthy lives and promote well-being for all at all ages. These are the targets and indicators. As for the global progress of SDG 3, before the COVID-19 pandemic, progress has been made in many health areas, including improving the health of the mothers and children, increasing immunization coverage, and reducing the incidence of communicable diseases. Not fast enough to meet the goal 3 targets by 2030. The disruption caused by the pandemic has now halted progress and even reversed some gains made. According to a recent survey, substantial disruptions persist more than a year into the pandemic, with about 90% of countries and territories still reporting one or more disruptions to essential health services. The SDG Goal 4 is ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. This is the summary of targets of SDG 4: complete free primary and secondary school for all, access to early childhood education and care, affordable quality technical, vocational, tertiary, and university, skills for employment and entrepreneurship, and knowledge and skills for sustainable development. Sustainable Development Goal 5: achieve gender equality and empower all women and girls. Sustainable Development Goal 6 is ensure availability and sustainable management of water and sanitation for all. These are the targets and indicators. As for the global progress of SDG 6, billions of people worldwide still live without safely managed drinking water, sanitation, and hygiene services, which are critical for protecting human health and containing the spread of the COVID-19 virus. Over the past century, global water use has increased at more than twice the rate of population growth. In addition to water stress, countries and territories are facing growing challenges linked to water pollution, degraded water-related ecosystems, water scarcity, caused by climate change, and a lack of cooperation on transboundary waters. The world is not on track to achieve Goal 6. Sustainable Development Goal 7: ensure access to affordable, reliable, sustainable, and modern energy for all. These are the targets and indicators. Sustainable Development Goal 8 is to promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. This is the comparison of before COVID-19 and after COVID-19. Sustainable Development Goal 19 is build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. These are the targets and indicators of Goal 9. Sustainable Development Goal 10: reduce inequality within and among countries. These are the targets and indicators of Goal 10. This is the comparison of COVID-19, before COVID-19 and after COVID-19. Sustainable Development Goal 11 is to make cities and human settlements inclusive, safe, resilient, and sustainable. These are the targets and indicators. Sustainable Development Goal 12 ensures sustainable consumption and production patterns. Um, This is the Sustainable Development Goal 19 is to take urgent action to combat climate change and its impacts. The targets include strengthen resilience and adaptive capacity to climate-related hazards and natural disasters in all countries, integrate climate change measures into national policies, strategies, and planning, improve education, awareness raising, and human and institutional capacity on climate change mitigation, adaptation, impact reduction, and early warning. The global progress of SDG 13 is atmospheric concentrations of the major greenhouse gases continue to increase despite the temporary reduction in emissions in 2020 related to measures taken in response to the COVID-19 pandemic. The 6 years from 2015 to 2020 are likely to be the warmest on record. Climate change is making the achievement of many goals less likely. To limit global warming to 1.5 degrees centigrade above pre-industrial levels in accordance with the Paris Agreement, the world would need to achieve net zero carbon dioxide emissions by around 2050. As of April 2020, 118 countries and territories had reported the development and adoption of national or local disaster risk reduction strategies, an increase from 48 countries and territories in the first years of Sendai framework. This is the climate crisis, which is largely continuing unabated. Goal number 15 is life below water. The targets and indicators are mentioned. The sustainability of our oceans is under severe threat. This is a pictorial representation of the same. Goal number 15 is life on land. The targets and indicators of the same are mentioned. Goal number 16 is peace and justice. The targets and indicators of the same are mentioned. Goal number 17, partnerships for the goals. Achieving sustainable development cannot be done by a single organization or government alone. Partnerships are an essential dimension to achieving the UN SDGs. The IAEA and its partners form important strands of the global sustainable development agenda by helping countries to use nuclear science to meet their development targets and work together towards achieving SDG 17 on strengthening the means of implementation and revitalizing the global partnership for sustainable development. National programs and interventions. Background. The World Health Organization envisions a world free from all forms of malnutrition, where all people achieve health and well being. Effective nutrition policies and actions exist, but are often inadequate in the face of complexity of the double burden of malnutrition, wasting, stunting, low birth weight, and micronutrient deficiencies on one hand, and overweight, obesity, and diet related non communicable diseases on the other hand. The goal of nutrition education is to reinforce specific nutrition related practices or behaviors to change habits that contribute to poor health. That is done by creating motivation for change among people, to establish desirable food and nutrition behavior for the promotion and protection of good health. Community based food and nutrition programs have been implemented in many countries. They have in common nutrition or nutrition related objectives, be it the broad objectives of reducing the prevalence of malnutrition or improving household food security, or more specific objectives related to a single micronutrient or a single nutrient activity, such as the promotion of breastfeeding. There are now a number of successful programs, and a close examination and analysis of these can help us to understand the process of achieving success. Community based nutrition programs. Evidence demonstrates that with careful design and phased implementation of different components, nutrition activities can enhance positive socio political factors, thereby creating a positive context for nutrition programs and for capacity building for the broader challenge of social development. Community based nutrition programs generally include such activities as growth monitoring, breastfeeding promotion, nutrition education, promotion of better weaning practices, micronutrient programs, and deworming. Success in these programs involves the attainment of objectives related to process, outcome, and sustainability, financial and functional, all of which are influenced by socio-political, technical, and financial factors. Four well-known programs generally acknowledged as successful are used to illustrate the combination of contextual, socio-political, programmatic, technical, and financial factors that ensure success in the community-based nutrition programs. The more technical programs are more instructive and replicable given the difficulty in creating conducive socio-political factors. The national programs include school health programs, a micronutrient initiative program, family planning, primary healthcare program, and Tawana Pakistan project. This is a brief nutrition history in Pakistan. Before devolution, pre 18th Amendment, and after the devolution. The policy and programs designed for impacting nutrition outcomes with respect to policies directly impacting nutritional status, breastfeeding, salt iodization, and food fortification efforts had also been woven into the historical context of nutrition within Pakistan. Uh, uh, as far as the food fortification is one of the most cost effective solutions to address the chronic micronutrient deficiencies without requiring changes in eating habits. Salt iodization. Breastfeeding and child nutrition. The protection of breastfeeding and child nutrition became official in 2002 with the purpose of raising exclusive breastfeeding rates in the country. After 7 years of delay in 2015, Pakistan, along with its development partner, also finalized the much needed national strategy on infant and young child feeding practices for 2016 to 2020. Uh, through its various plans, programs, and policies, the government of Pakistan has managed to bring nutrition into the political stream by making it part of the Pakistan Vision 2025. In the post revolution context, cross sectoral dialogues about nutrition have begun in each of the provinces, led by the PDDs and technically supported by the development partners. While momentum has been built, it has been sharpened and sustained. The government has consistently noted its commitment to the goal of achieving food security and adequate nutrition among all its people, even if sometimes its achievements and efforts may have fallen short of its commitment. Now, the Integrated Reproductive Maternal, Newborn, and Child Health (IRMNCH) and Nutrition Program. Uh, the IM, The IR, MNCH, and nutrition programs include the school health and nutrition programs. The school health and nutrition program services remain a component of the health service delivery. This program can contribute to improve health, nutrition, learning performance, increase school enrollment, attendance, better hygiene practices in the community, and to achieve the MDGs for health education and child protection. The objectives is the screening of the primary and middle school children for detection of common health problems by general physical examination and examination of eye, ENT, dental, and bring about an improvement in the quality of life of school children, capacity building of school teachers for screening of children and promotion of hygiene education among the school children, identification of problems after screening, and referral of students to BHUs, RHCs, THQs, DHQs, and tertiary care hospital if required. Implementation partners include Punjab Health Sector Reforms Program, Health Department, Education Department, district governments, and UNICEF. Provincial coordination has been entrusted to the Director General Health Services Punjab. A provincial focal point has been established. Monitoring, supervision, technical support, collection of reports, and feedback to the districts is being implemented. This is the outline. The school health and nutrition visit every primary and secondary middle school of the catchment areas, preferably once in a month for delivering lectures on health education and health lifestyle. After screening, if any problem is detected, the student is referred to BHU, and if the problem cannot be treated at the BHU level, the medical officer can refer the student to any available nearest specialty like RHC, THQ, DHU, or tertiary care hospital. The management and treatment of the student is provided free of cost, but in case some expenditure is involved, then the school councils, local NGOs, or philanthropists may be approached. Process steps of the program. The school health program has essentially the following four basic steps: capacity building of the teachers, establishment of the referral system, corrective and curative care of the primary school students, and formation of a community support system. Nutrition interventions of Tawana Pakistan project. The nutritional interventions include deworming drugs, noon meal, and micronutrient supplements. And benefits to school girls include improved nutritional status, prevention of infections and nutritional deficiency diseases, and improved school enrollment and performance. About the Punjab Food Authority, it has been working as a functional entity in Punjab province across 36 districts since the July 2012. It proposes the amendments in nutrition topics consisting of 7 sections for the official website of the Punjab Food Authority so that people can have access to the authentic information conveniently and to target the maximum audience to have awareness regarding food consumption and health. What we know, child wasting levels remain extremely high in Pakistan and coverage of wasting treatment services is low. Mainstreaming nutrition specific interventions into primary healthcare services. The challenges include fragmented information system, weak supply and logistics management, and reliance on short-term funding grants, resulting in a lack of sustainability. Program coverage therefore remained limited. In 2019, around 65,000 children were treated countrywide for severe acute malnutrition, and 175,000 children were treated for moderate acute malnutrition, with an overall coverage of around 5%. CMAM continued to be implemented as a vertical program located under the same roof as health services within each province, but with separate staff, supply chain, and information management system not integrated within existing governments. Evolution of approaches to wasting treatment in Pakistan, inclusion of selected nutrition specific interventions into the routine package of services delivered at the primary healthcare level. A minimum essential nutrition package, which included wasting treatment services and key prevention and promotion services, including young infant and child feeding services, counseling, vitamin A supplementation, deworming, and multiple micronutrient supplementation (MMS) for children and pregnant and lactating women. to become part of the universal health benefits package delivered routinely through the government health system by the existing health workforce, advocacy for the allocation of the necessary resources to implement the management of wasting at scale in Pakistan through the primary healthcare system, development of workforce capacity, integration into government supply chain and information systems, local production of lipid-based specialized nutrient supplements, ready-to-use therapeutic food, and ready-to-use supplementary food for the treatment of moderate acute malnutrition and severe acute malnutrition, now at the advanced stage of production and are being used in the implementation of CMAM programming. And the lastly, institutional arrangements. The government of Pakistan has partnered with the World Food Programme and MI, a micronutrient initiative to address the micronutrient deficiencies. Food Fortification Program, National International Nutrition International, in collaboration with is implementing a large-scale food fortification program in 56 districts across Pakistan, so to support the national and provincial governments' fortification efforts. Family Planning and Primary Healthcare Program. The National Program for Family Planning and Primary Healthcare was launched in 1994. It is one of the largest community-based programs in the world, providing primary healthcare services to about 80 million people, most of which is rural poor. The program has been instrumental in improving health-related indicators of maternal and child health in the last 2 decades. Now, the recent updates, how the UN is supporting the Sustainable Development Goals in Pakistan. The UN in Pakistan has been supporting in various aspects of its endeavors to realize the Sustainable Development Goals. In 2018, the government of Pakistan and the UN in Pakistan signed the UN Sustainable Development Framework, also known as the Pakistan One United Nations Program, OP3. This framework is a medium-term strategic planning document with planned results focusing on 10 key outcomes, which are identified through extensive consultation with multiple stakeholders and in alignment with the Pakistan's development priorities. Pakistan's future faces many hurdles and its progress towards the Sustainable Development Goals is stagnating. Unless there is a major shift in approach, the country faces a difficult future. Pakistan is ranked 129th out of the 165 countries in a recent Sustainable Development Goal Index ranking, with an overall score of 57.7%, mainly for its progress on one of the 17 goals, which is climate action. The country saw moderate improvements in the goals for poverty, health and well-being, water and sanitation, decent work, peace and justice, and partnership, but it stagnated on zero hunger, quality education, gender equality, clean energy, innovation, sustainable cities and community, and life below water. It actually went backwards on life on land. Nutrition, nearly 10 million Pakistani children suffer from stunting. Only 38% of children are exclusively breastfed for the first 6 months of life. As a result, more than half of the children under 5 years of age are deficient in vitamin A, 40% are deficient in both zinc and vitamin D, and nearly 62% are anemic. The devastating result of acute malnutrition leads to literally wasting away to skin and bones. Wasting is extremely high in Pakistan, with several areas in the country considered to be at emergency level of wasting. While programs to care and treat severe acute malnutrition are highly effective in Pakistan, achieving cure rates above global standards, they are covering less than 5% of the total numbers of malnourished children. 8 out of 10 children in Pakistan do not eat right type and quantity of food. In the interest of time, I'm starting with the MCQs. MCQ number 1, a major coastal city XYZ is seeing more frequent and intense flooding due to sea level rise and extreme weather events. The health department wants to develop a climate resilience strategy to protect local communities from health impacts related to climate change. Which SDG would be most relevant as a framework? A. SDG 7, B. SDG 9, C. SDG 11, D. SDG 13, and E. SDG 15. So the answer is D. SDG 13. The government of Pakistan is aligning its national education policies and plans with the UN Sustainable Development Goals. Which of the following educational targets is not included in the SDGs and Pakistan Vision 2025? Provide free and compulsory primary and secondary education to all children in Pakistan. B. Ensure equal access for all women and men to affordable technical and vocational education. Increase the number of youth and adults who have relevant skills for employment and entrepreneurship. Ensure completely free higher education for all individuals. And eliminate gender disparities in access to education.
D.
D.
The answer is D. To make a progress on the UN Sustainable Development Goals in Pakistan, coordination across many dimensions is required. Which of the following dimensions is the most necessary for the achievement of SDGs in Pakistan? Partnerships between government, civil society, and private sector, policy making at the national level and provincial levels, funding from domestic and international sources, implementation of programs and initiatives, monitoring and evaluation of progress.
A.
Yes,
A.
the answer is A. Pakistan aims to transition to a more sustainable development pathway that balances economic growth with environmental protection. Which of the following statements best explains the concept of sustainable development in the context of Pakistan? A. Using natural resources minimally to preserve them indefinitely. B. Exploiting natural resources maximally for economic benefit. C. Managing a natural resource use so they are available for future generations. D. Preserving natural resources only for future generations. And E. Protecting environments without considering economic impacts.
B.
It is C.
C.
Managing natural
C.
resources so they are available for future generations. Uh, the XYC study found that the success of community based nutrition activities is dependent on careful planning and phased execution of power arrangements and social connections affecting nutrition programs. In this situation, the factors responsible for the effectiveness of community based nutrition efforts are A. Economic factors, B. Financial factors, C. Political factors, D. Socio-political factors, and E. Technical factors.
D.
B.
The
D.
D. Socio-political factors.
C.
MCQ number 6. The most common health screenings in school are done in collaboration with the local public health department. Which of the following is not done on a regular basis in school health program? A. Blood reports. B. Sputum smear microscopy. C. Dental health screening. D. Ear checkup, and E. Eye checkup.
A.
A.
The answer is B. Sputum smear microscopy. A 5-month-old infant girl in Karachi is underweight. Her mother, aged 39, has been exclusively breastfeeding and wants advice on introducing complementary foods. According to WHO guidance, what is the best nutritional plan to recommend at this stage? A. Continue exclusive breastfeeding until 1 stage. B. Start iron supplements and vitamin A drops. C. Begin feeding cereal mixed with breast milk. Introduce a variety of soft mashed food 2 to 3 times per day. Provide commercial baby food pouches 3 times per day.
D.
D.
Yes, the answer
D.
is D. In Pakistan, child wasting remains high and wasting treatment services are neglected. Integration of important nutrition treatments into which healthcare level is required? A. Primary healthcare level. B. Private sector hospital level. C. Provincial Department of Health. Secondary healthcare level. And E. Tertiary healthcare level.
A.
A.
Primary healthcare.
A.
Yes. The answer is A. Acute malnutrition leading to wasting or low weight for height is a critical public health issue affecting children in Pakistan. According to recent national nutrition surveys, which proportion of children under 5 in Pakistan do not eat the right type and quantity of food? A. 2 out of 10, B. 4 out of 10, C. 6 out of 10, D. 8 out of 10, and E. 9 out of 10.
D.
D.
Yes, the answer is D. Pakistan has high rates of malnutrition, particularly among women and children. The government wishes to improve nutrition through national programs and policies. Which type of nutritional intervention would be the highest priority to implement in Pakistan? A. Distribution of nutritional supplements. B. Nutrition education in schools. C. Food fortification programs. D. Sustainable agriculture initiatives. And E. Conditional cash transfers.
C.
C.
Yes, the answer is this is the key of the MCQs. This is the YouTube link of our channel, and thank you very much.
Thank you very much, Dr. Ramsha. It is a very nice presentation. My comment is about the school health services and the screening program that you have shown. Very important thing is also the personal hygiene and the biochemical assessment of using the laboratory measures for malnutrition. That is also the part of the screening of the school health services. And we know that in most of the cases, even very common things like the ear examination, eye examination, anthropometric measures, they are not done regularly. And to much of our surprise is that even the personal hygiene, like the detection of scabies, lices, and hand washing, etc., they are also not there. And the screening of scabies is so essential because it is all clinical based. The screening of the malnutrition is, however, little complex, and we know the laboratory measures like serum micronutrient level, serum lipids, the blood sugar levels, serum albumin levels, immunological parameters, in order to assess the general nutrition as well as the specific nutritional deficiencies among the school children. They are not there. We also know that the most of us know that the urine examination is also the essential part of the screening of malnutrition, and there are different important tests like the proteins in the urine, sugars in the urine, and the iodine levels in the urine that are very necessary for the screening of the school health. As far as SDGs are concerned, it is a very good presentation where most of the SDGs they have been covered in detail and very well done. I'm so grateful to everyone who are participating regularly, and especially the presenter, Dr. Ramsha Khan, who has worked very hard in order to make all these things clear to everyone. If you have any questions, you can put in this chat box, and we can answer your questions in the end of these presentations. The last important thing is that as we are moving towards achieving the SDGs, we know that Pakistan is lying far behind many countries in achievement of SDGs, especially linked with the child health. So the anthropometric measures, biochemical and clinical assessment of children, that is necessary. It should be provided at every doorstep in schools and at the community level in order to get SDGs better and to achieve them within the time frames. So very well done, everybody. And today we would have face-to-face discussion. Dr. Hansa would join us. And if you have any question, please make it clear that those face-to-face discussions should lead you to the clear concepts, and all the important things should be discussed. So thank you once again. I think the two important things that has to be discussed in face-to-face meeting, first is about the SDGs, how the Pakistan is lagging behind in different SDGs, especially related with health indicators, and how to make the things better, expedite this process. And the second important thing that we have to discuss is about the biochemical indicators of nutritional status. And the third, it is up to you, whatever you want to discuss or want to put forward in today's meeting. Thank you